Good evening, everyone. I would like to welcome you to tonight's virtual webinar titled Mastering Aesthetic Excellence, PicoWay's multifaceted approach to acne scars, wrinkles, pigmentation treatment, and tattoo removal. If you have questions during today's event, please enter them in the Q&A box. We will answer them as we go along. If you encounter any issues with the video or connection, please refresh your browser, as that will often fix minor issues. Google Chrome is the preferred browser. The information and photographs contained in this presentation are the property of Candela and its consulting healthcare providers and are provided for educational and discussion purposes only. By sharing this information, neither Candela nor any of its consulting physicians give you the right to use the information presented. By participating in this webinar, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the webinar. With that, I would like to introduce Dr. Konika Patel Schallen, SVP of Clinical Operations and Medical Director of Candela, the moderator of this event tonight. Dr. Schallen, the floor is yours.
Thank you very much, Aviva. And I just want to welcome everybody again on behalf of the team at Candela. We're very, very happy to have two excellent speakers today who have an extensive knowledge of lasers and extensive experience with PicoWay. It is a wonderful device. For those of you who have it, you already know it, and you'll be learning some tips and tricks and lovely, useful pieces of advice that you can use. And for those of you who are interested in looking, I think that you will be duly impressed by the variety and the width, as well as the breadth, and also the specialty of the device. So not only can you do so many different things for all the patients that make many, many patients happy with skin rejuvenation, it's also really such a specialty laser for difficult pigmentation and of course for tattoo removal. Just briefly, the pigment market overview is very substantial, and picosecond lasers really have emerged as the technology of choice to treat pigment due to the clinical efficacy and low downtime. And the big important thing to remember is that a picosecond laser is only a true picosecond laser if it has a low picosecond pulse range and the pulses are delivered in that true picosecond pulse in a very even pattern. And there's a lot of information on what makes the PicoWay laser very special because of its incredible stability in pulse delivery, as well as its wavelength. So I encourage you, if you have questions at the end of the program, to reach out to your clinical contact or your distributor contact or your local representative to learn more, because there's quite a lot of wonderful scientific information. Picosecond lasers are really, truly better than nanosecond lasers for pigment, especially for difficult pigment. Many diode and IPL systems can be used to treat basic pigment as well, but Pico goes the next step to treat some of the difficult pigmentation or difficult patients. And so there's a wonderful opportunity. And as I mentioned, there's an opportunity to use this across the board in your patients. I always say that Pico really helped me to build my practice because the rejuvenation that it afforded with the Resolve handpieces was so visible and so lovely. The results were so lovely that patients would ask, what have you had done? And then I had several new patients that came just from the advertisement of the current patients. So it is an opportunity to democratize this treatment. It's very, very easy for me to delegate the treatment, and that's very helpful. For tattoo removal is a very large growth opportunity, especially in many different segments where you have multiple offices. There is quite a bit of growth. And we know that we're always cleaning up tattoos that have been done with inferior lasers that can't quite get all the pigment or can't quite reach all the colors with this particular laser with PicoWay, because of its pulse durations that are very short and because of its breadth of 3 different types of wavelengths. So it's quite an opportunity. But I want to really spend the rest of the time allowing Dr. Lukic and Dr. Martin to have the floor. Dr. Branislav Lukic is from Serbia, and he's a certified aesthetic medicine doctor and an ophthalmologist that specializes in oculoplasty. He's been on the Serbia's Regulatory National Board for Aesthetic Medicine and has really extensive experience. And he is also quite a busy practitioner with a clinic in Belgrade focusing on laser combinations, injectables, and surgeries. And Dr. Andrei Martin is based in Romania, centered in Romania. He is also a highly experienced plastic surgeon and owner and medical director of Klinika Medispa in a variety of places in Romania as well, but now expanding, and it's very exciting. He is trained originally in plastic surgery and burns in Bucharest, and has had a vast experience in a lot of different types of plastic as well as aesthetic surgery. And so he's been focusing on surgery and scar treatments, and that has transitioned over to a lot of energy-based treatments as well, and minimally invasive anti-aging procedures. So without further ado, I'm going to turn the floor over to you, Dr. Lukic. This is a big day for you. I just also want to tell the audience that Dr. Lukic, we wish you a congratulations on your recent marriage. So thank you for joining us today, and I'll turn it over to you.
Thank you very much. It's really an honor to speak for Candela, like always. So I will just start immediately because Konika made a great introduction for me. Thank you very much again. So when we talk about PicoWay laser and treatments, PicoWay, that sentence means that we deliver a huge amount of energy in a 1/1,000,000th of a second. That means pico. And it can be used for tattoo removal, benign pigmented lesion, acne scars, and anti-aging or treatment of wrinkles. So when we talk about lasers in general, just a quick follow-up. When we talk about physics and lasers in general, we talk about wavelength, pulse duration, fluence, and spot size. When we talk about wavelength in PicoWay laser, we talk about Nd:YAG, that is 1064. Nd:YAG is the medium for the PicoWay laser. And it can also be through the lenses with the refractive optics to 532 and 785 and 730. When it comes to the pulse duration, it goes from 450 to 300 picoseconds. And fluence, we express the strength from the laser, and we apply it in joules per square centimeters. And also we have a spot size, which can go from 2 to 10 millimeters. So when we talk about effects of the PicoWay laser to the tissue, we have this comparison here, ablative and non-ablative and picosecond lasers, where we see that photoacoustic effect, which I'll explain in the next slide, it keeps the tissue intact. Actually, the superficial layer of the tissue of the skin is intact, stratum corneum to be exact. And compared to the other effects of the laser, the downtime is much shorter and the complications are much less frequent than when you use the other technologies. So when we have a photothermal and photoacoustic effect, photothermal means that we convert the light energy to the thermal energy, to the heat. And that's how we apply to the chromophore, which can be pigmentation or artificial pigment. Or we can have a photoacoustic effect with PicoWay laser, where we convert the light energy to mechanical energy. And it's basically, as it's in the picture, like a really, really super small hammer that disperses the pigmentation or the chromophore and activates the immune cells to do the job of removing the pigmentation or collagenesis in terms of microphoto damage that is controlled, and that's how we get anti-aging effect. So when it comes to the indication, one more time, we have wrinkles, anti-aging, acne scarring, benign pigmented lesion, and tattoo removal. Here we see that every color has correspondent wavelength. That means that 532 corresponds to red, yellow, and orange. 730 and 785 corresponds to green, blue, and light green and light blue. And I can add that this is the only laser that really actually remove these colors, which is very important, especially when it comes to permanent makeup tattoos, because of the minerals inside. And you can start with a black color and go into the yellow, green, purple, and so and so. That's why Pico, even in Ivka's discussion, was really the dominant, PicoWay Candela was the dominant laser for tattoo removals when it comes to the permanent makeup. And 1064 corresponds to the darker colors, particularly black, but also you can also react on brown, green, and blue, dark green, and dark purple. So one more time, we have the nanosecond versus the picosecond. We have here schematic show that nanoseconds just disperse the pigment, but not as little as the PicoWay laser, which disperses to the sand. And Q switch laser and older technologies is reducing the pigmentation, which we can see on pathohistology here, to the pebbles, and PicoWay to the sand. Why is that important? Because our immune cells basically eat the dispersed pigmentation, and that's how we get the effect of either tattoo removal or anti-aging, because we activate the healing process of the tissue and then collagenesis, which my colleague Dr. Andrei will speak much more later. Also, this is a great example where we can see the white bottles, because white color doesn't absorb the light. So here we see how the difference between Q switch and nanosecond laser between Pico and absolute dominance with the PicoWay laser. And here is only 450 picoseconds, but we also have hand pieces where it goes to 300, as we saw before. So it's really as I say, at least the golden standard for tattoo removals, definitely. So how do we do the tattoo removal? We can remove the particle. We can also have a reduction of particle size, and also the photochemical transformation of the pigmentation to colorless, and then you basically see the less of the artificial pigment in the skin. So the endpoint is really easy with the PicoWay laser. When it comes to the pigmentation tattoo, we have this popcorn effect, which is basically when we hit the artificial pigment and we get the frosting. Why is that also amazing? Because with Pico, when we get the frosting, even if we apply the energy at the same spot, we cannot burn the patient or damage the tissue of the patient. So that's why Pico is extremely safe to use. And also erythema and swelling is a great indicator for any kind of anti-aging treatment. And that's how we know that we started the collagenesis process in the tissue. For benign pigment lesion, the only important thing to remember here is the deeper the pigmentation is, we get a darkening. So when we use 1064, we get a darkening of pigmentation. But if the pigmentation is superficial, then we use Pico Zoom handpiece 532 and get frosting. So we have to differentiate between these two, because if you get the frosting with 1064, that means the energy is a bit higher than it's supposed to be. And for any post-care, any laser, and all of the lasers can be used through entire year. At least I use them because, especially in the US, you have summer, especially in Miami and places like that, summer and hot weather throughout all the year. So with proper sun protection and topical treatment like recovery creams, you can use this laser throughout the entire year. So you have no limitation when it comes to the weather season. And I'm here today to talk about combination. And combination is always the key. What does that mean? It means that we utilize all the available resources we have at our disposal for tailored approach for our patient. And not only aesthetic medicine, but any kind of medicine have the best outcomes when you integrate all the resources you have at your disposal and make a combination of techniques and technologies to get a better result, which you can have with your experience and with your results with your patients. And it's a great way to enhance patient treatment and effectively apply your knowledge. And I got a question at the last Candela Academy, why do I combine? Is because I can. And that's, I think, is the most important thing from this webinar, to always think all that you have and to combine all that you can for best results. And you should always embrace the creativity and just the outcomes you can reach with proper combination with what resources you have. So when it comes to the thought process, when patient arrives is in your clinic, you first do a thorough clinical examination, and then you also have to consider the budget, at least in Balkan. And then if the budget is limited, you always prioritize what is the main target or a primary resource that you use, and also develop a solid plan and schedule the appointments, and always never give definitive statements on the number of treatments for your patients, because in medicine, 1 and 1 is not always 2. Sometimes it's 4, sometimes it's 0. So that's why you always have to be careful and manage expectations and aim for realistic outcomes with your patient. And so what I mean when I say that, when we have benign pigmented lesions, I always start, firstly, in Balkan, in Serbia, we have Fitzpatrick types 1, 2, sometimes 3. And then it's a lot easier for me than, for instance, in US, where you have all sorts of Fitzpatrick types of the skin. So with benign pigmented lesion, I always do the Pico toning, which I use PicoWay Zoom Hand PicoWay Zoom Hand Piece 1064. You put this parameter with a very, very high frequency, so that means low energy and high frequency, and you remove the pigment amazingly without causing overheating, which is great for some pigmentation that is really reactive to the heating or mechanical stress. And then I go to the focal lesions when it comes, for instance, solar lentigo and stuff like that. You use focally Pico Zoom 1064 or 532. And then I just recently bought the 1940 Frax, which is amazing headpiece from Nordlist, which gives this great skin resurfacing, which basically it removes the 200 microns of the skin. And you can also combine this with either IPL technologies from Nordlist, for instance, because I have only Candela energy-based device, or from Gentle Lace, Alexandrite, or NDR from Gentle Lace with specifically very light skin types, because Alexandrite is amazing laser, very potent, but you have to be very careful when you use it on Fitzpatrick types from 3 and so on. And also injectables that I use is succinic acid, glutathione, exosome, etc., which I usually apply when it comes to the hyperpigmentation with microneedling. And I use skin boosters, not only because of the anti-aging effect, but also because you strengthen the dermal barrier of the skin. And that's how you reduce the inflammation in the skin. And that's how you reduce the reactive hyperpigmentation afterwards. And the home care is always a big accent. I always tell my patient, 50% is me and my treatments, and 50% is your care home, which means sun protection and topical therapy. And I combine tranexamic acid, kojic acid, retinol, hydroquinone, thiamidol, and so, depending on the indication I deal with. So when it comes to the acne scars and rosacea, also the same, Fitzpatrick, of course. I always use the same approach, but with Pico toning, but also I add the Pico Resolve, and you have scar reduction, but you also communicate with your patient that you're not only getting the scar reduction with Pico, you're also getting amazing anti-aging effect that stacks. And when you stack all these effects, so you have multiple effects and multiple great results for your patients, and that's how they really enjoy in their treatment if you communicate properly. I combine it with 1550 Frax Pro and with 1940 sometimes if it's post-inflammatory hyperpigmentation. And with injectables, in this particular case, I always use the collagen boosters or skin booster with sub-incision for the scars, because if you have a scar in the skin, it's always recommended at least to do the sub-incision with a blunt cannula to move the scar towards the superficial layer of the skin. And that's how the laser and all that you use superficially on the skin can reach better. And also the home care is the same. For scars and striae is the same treatment, but this is the accent for Pico Resolve. I will not talk too much about Pico Resolve handpiece now, which is fractionated Pico beam, because Dr. Andrei will talk later. But I always combine the Pico Resolve with Frax 1550, and then it gives great combination with injectables, and you do all that at the same treatment. So now we're here to clinical cases that I managed to reach with my practice and my combination. So this is the patient that initially came to the visit for pigmentations through the entire skin and for improvement of skin laxity, and for improvement of skin laxity, and also migrated fillers, but that's not important and relevant now. And I did the CO2, and after CO2, the second picture, it was 10 days after the initial treatment. My patient applied sun protection everywhere, but on the spot that we apply CO2. So we have this amazing hyperpigmentation, post-inflammatory hyperpigmentation. And then I did the Pico with Pico Zoom, Pico toning, and then Pico Resolve with topical exosomes with microneedling and succinic acid. And you see the 1 month later, the entire post-inflammatory hyperpigmentation is removed. Also here we can see the entire face basically, which is not post-inflammatory, but just the hyperpigmentation from why the patient initially came to the clinic. Here we can see a patient that initially came after removal with plasma pen from the cyst and warts on the face, and she had big post-inflammatory hyperpigmentation. And this is the best example how you can combine the PicoWay laser with Frax Pro laser and get this amazing result. Succinic acid I applied via microneedling, and of course with this home care. Here we can see the left and right side of the face of the patient. And really the Pico gives these amazing results. I'll just repeat one more time, with 2 days downtime, maybe even less. And they can apply makeup immediately and just go on their day. There's no swelling, there's no falling apart for 10 days, just a laser that goes underneath the stratum corneum, and you have these amazing results, basically like you change the entire face or skin, or did the entire resurfacing with CO2. Here we can see hyperpigmentation, melasma, and this is a great example and how I like to use PicoWay laser, because it gives the least trauma to the tissue, because we have, instead of hitting the pigmentation, hitting the melanin in the skin, we have dispersing the melanin in the skin And that's how we remove the melanin from the skin and remove the hyperpigmentation. At the same time, you strengthen the skin barrier with PicoResolve, and then you add something that is counterintuitive with succinic acid and microneedling, and you have this amazing result because you reduce the hyperpigmentation, you reduce the inflammation, and you get the collagenesis and really great outcome for your patient. Here we can see the focal lesion when it comes to the solar lentigo. This is my colleague, and only one treatment, and it's really easy and practically no downtime with Pico. Another case of melasma. We all know that melasma with other treatments can really react that way or that way. It can really get worse, a lot worse, if you treat it or try to treat it. But Pico, at least from my side of experience and from my clinical practice so far, gives me the best options to treat conditions like this without any complications. Here we see the mixed indication because we have hemangioma, telangiectasia, and pigmentation. So I combine the Pico with Nordlis, with IPL, and it really have amazing results in only one treatment and practically no downtime. And this is my favorite slide, actually, because here we see the Fitzpatrick type 6. And here we see the grave post-inflammatory hyperpigmentation after TCA with dark skin patient. And it was really uneven hyperpigmentation and really not a happy patient. I didn't do the TCA. And then the only thing is the blurry pictures before are sadly made by patient. I didn't do the before pictures on my own, but I think you can appreciate the result and see the big difference. Here you use PicoWay zoom, but only you just reduce the fluence a little bit because it's still the dark skin patient and a lot of melanin, and you want to target the only post-inflammatory hyperpigmentation and even the pigment. So I use 0.4 fluence for this particular patient, and then use the bleaching agents with hyaluronic acid with microneedling, and this is only one treatment, and it's really a very happy patient because if you have post-inflammatory hyperpigmentation on your face, it's really awful and damaging, psychologically damaging to your patients. So you have to always at least try to do something because worse from this, you just cannot get. Another also interesting example is I'm an ophthalmologist, and when you do the blepharoplasty, upper and lower, you have sometimes bleeding and hematoma and swelling. And if the patient is not using the sun protection properly, like my CO2 patient, you can get converting the hemoglobin from the bruise to really hyperpigmentation, and PicoResolve for that is the best. And I only say it like that because I have a lot of that in my practice, because all of my colleagues, they do blepharoplasty. They always send me patients if they have hematoma, and then post-inflammatory hyperpigmentation from that hematoma afterwards. And it's really easy and very elegant. Maybe I would just shortly mention, sometimes when you have semi-ptosis from Botox, PicoWay Resolve does wonders if you do it in first 15 days, and it improves and heals the condition and the complication you caused with Botox, but probably it's the topic for something else. So another case of melasma. Also, I would like my colleagues to appreciate here is what is really now a big hit is moving the hairline, especially with women when they have short forehead, and then you basically draw the hairline with gentle lace and gentle marks, and it's really great. It changes the entire appearance, and you have amazing results, as you can see. But the main indication here is, of course, melasma and even in the hyperpigmentation. Here is a very interesting case because here we have the patient did CO2 skin resurfacing in her bikini area, and then she got, without the sun, huge post-inflammatory hyperpigmentation, and this is only PicoWay. And I had several cases, sadly not several pictures, but several cases of this intimate rejuvenation with PicoWay laser, which gives great results, practically no pain, no downtime, and really life-changing results, especially also with patients that are a bit overweight and you have this mechanical traction of the inner thighs, especially with women. It can be damaging and it can be a problem for them. And with Pico, there's a sure way you can remove this, especially in this case, as you can see, in only 2 treatments. So if you combine with 1550, as I told before, this is the one of the best results I have. This is the patient that was a victim from a non-medical person that did a facelift and then phenol peeling. And the before picture was 8 months after the procedures. And this here I combined Pico with Nordis at the same time. Nordis to remove the red and the pink and dark pink, with IPL, Frax to reduce the scarring and to reduce the contracture of the tissue because of the scarring, and then PicoWay all around to even up the pigmentation. It's practically like applying makeup. If you treat a scar, you have to treat the skin around the scar to achieve the best results. And this is the result of 8 treatments with 4 weeks apart, which I talked, who knows me from Candela Academy, there. This is also a great example which you can achieve with Frax Pro and Resolve. And mesotherapy, we have in Serbia at least injectables with vitamin C and retinol, and this is the result for 4 treatments and 4 weeks apart. Here we see the suicide attempt and knife wound on the neck. The upper 2 pictures are without flesh, and the lower 2 pictures are with flesh. Of course, when you have a suicide victim patient, you always want to reduce the markings on their face or on their neck, because it's also big psychological damage to them, because if they recovering from something like that, that's horrible, they need to have they need to not see the results from their attempts. And this is the 2 treatments only result. In Serbia, I mean, in Balkan, we had a very strange situation where we had the nose reduction with a non-medical person with plasma pen laser, but it was practically this AliExpress plasma pen. And basically, the woman who did it burned the entire noses from these poor patients, and then made keloids, hypertrophy scars, atrophy scars. And when you have a combination from atrophy scars and hypertrophy, really the best combination is to use Pico and Frax Pro at the same time. And here you can see the result. And these are all young patients, young women, with humongous scars in the center of the face, which is their nose. And this is amazing result only with 1 treatment. I'm trying to be fast so we can cover everything and all the results and Dr. Andrei at the same time. Also here the same. There's all the same written, the same patients from the same persons. Okay, so here I will speed up a little bit. So here I just want to shortly, if you have pigmentation and atrophy scars, Pico is the way to go. And here we see an old scar from C-section. And here we see a mixture of a scar. That's why thorough clinical examination is always important to reduce the vascularity, pigmentation, atrophic and hypertrophic parts at the same time. That's why you combine everything. And here is the moderate result from a person that is a heavy smoker. So when you treat the patient, you also have to put into account their lifestyle. Here also some old scars. I will just go through the scars and the stria now. And tattoo removal. Tattoo removal is, as I said, for me, the PicoWay Candela is the golden standard for tattoo removal. Here you can see how it removes the tattoos in only three treatments, 4 weeks apart, without, of course, any scarring or anything like that. Any other technology that is older can always have bigger scarring. What is here interesting is when you have a patient that went through other lasers to remove the tattoos, we can have scarring over the pigmentation. And if you have the scarring over the pigmentation, you have to explain your patient that tattoo removal will be longer for them than usual. And here, 9 treatments, but this is a tattoo over a tattoo, a cover-up. So that's why you can also have this situation, but also you can have this kind of situation when this is only 1 treatment and you remove the entire tattoo from 1 treatment. Basically, the number of treatments is because you have either amount of pigmentation in your skin and the depth of the pigmentation in your skin and existence of scar or not existence of the scar. And here you can also see some results from the tattoo removal. Sometimes some tattoos surprise you, and sometimes some tattoos disappear very fast, like for instance this, especially on the fingers and stuff like that, because usually that pigmentation is already very bad absorbed from the tattoo itself. So when you remove it, it's fairly easy. Here are some other examples. And I would like to show you just shortly 2 videos how basically it looks like. It's starting. So this is the permanent makeup tattoo removal, where you get this frosting. Frosting, once again, is the gas that's released when you apply the energy to the artificial pigment in the tissue. And it's very fast, it's very easy. You do it under topical anesthesia. And the other video is the same tattoo removal, but just on the other part of the body. I don't know if it's playing. Sorry for the sound. But basically, that was just to present you how it looks. The treatment is very fast, very efficient, very easy, and practically no downtime. And with this, I would like to say thank you for your attention. And if you have any questions, please ask. And I would like to leave the floor and let my dear colleague, Dr. Andrei, to continue in explaining this amazing platform.
Those were some amazing, so many amazing results. Thank you so much for sharing that. There's lots in there. We'll turn it over to Andrei. Dr. Martin.
Okay, I'm here. Hope you hear me.
Yes.
First of all, I would like to congratulate Bane for his great results, for his great presentation, combining lasers, different kinds of lasers, energy-based devices, injectables, fillers, Botox, metal therapy, can give the best outcome to our patients. In my presentation, I'll just stick to the PicoWay, just to be able to point it out what can it give to the plastic surgeon, also to the dermatologist. So first of all, we should point it out what PicoWay Resolve means, because in the term of histology, we have this study. They took 6 skin samples, and they, after the biopsy, they treated with the Resolve 532 nanometers handpiece, and also with the Resolve 1064. And the samples were examined by a dermatologist for an intradermal laser-reduced optical breakdowns and intradermal laser-reduced cavitation. So the results were, we'll get superficial intradermal LIOBs, laser-induced optical breakdowns, were seen in skin treated with higher laser energies, and deep intradermal cavitations were seen in skin treated at lower energies. It is a little bit counterintuitive, this one. So this is the histology behind the PicoWay Resolve. The vacuoles in the epidermal, the LIOBs, and the laser-induced cavitation in the dermis. So this translates in histology. At the hematoxylin eosin stain section on the skin tissue showing 0.2 millimeter diameter vacuoles in the upper dermis caused by laser-induced optical breakdown. The tissue section was taken immediately after the laser radiation. And on the right side, we have the tissue section stained with Herovich stain, which is a stain specific for collagen, to show new collagen formation from healing of the LIOB damage. The sample of the biopsy was taken 30 days after the laser irradiation. On the right side, you can see the mature collagen, collagen 1 stained in red, whereas the young collagen, collagen 3, is stained in blue. So these are the clearance for the PicoWay. We have tattoo removal clearance since, I think, 2012, and then it expanded to benign pigmented lesions and skin texture rejuvenation via wrinkles and acne scarring. So just to present you some clinical cases. This is a very simple tattoo, a black one located on the back. This is before and after 2 sessions of 1064, 5 millimeter spot, 1.2 joules at 3 months. What about this one? It seems an easy to remove tattoo, an easy clearance. It is a black and blue tattoo, fine line, not too much pigment, and it has to be cleared in 3 to 5 sessions at least. But it took almost 11 sessions. Actually, it took, I think, 16 sessions because the patient did also 5 sessions before she came. So I think the most important thing why it took so long is the location of this tattoo, because there are some body areas like wrist area, ankle area, soles, and the plantar area, where removal of the tattoo is very painful and it is very slow. We should expect at least 10 to 12 sessions to remove it. Mainly because we have a thick epidermis and a very, very thin dermis, and there are lack of resources to wash, let's see, the pigment from this area. In addition, you can see that particularly this tattoo here in the upper pole has some steps and some kind of scarring. So if for sure there were some kind of pinpoint bleeding, so if you add this scarring process at this tattoo, it will be very difficult to remove. So this is the result before and after 11 sessions, 1064, 5 millimeter spot at 3 and 6 months, and 1 session of 70-85, 4 millimeter spot, 0.8 joules. A red tattoo before and after 4 sessions of 532 nanometers, 5 millimeter spot, 0.6 to 0.8 joules per square meter at 2 to 3 months, you can see a little bit, let's say, a hypopigmented area. Maybe this is because the patient was a little bit tan, but I'm sure that in the future, this small problem will be solved. A multicolor tattoo, we did 4 sessions, 1064, 5 millimeter spot, and 4 millimeter spot for black ink. Red, we treated with the 532 nanometers, 5 millimeter spot, and 4 millimeter spot. And the blue one, we treated with 785 nanometers, 4 millimeter spot, and 3 millimeter spot. So the work is in progress, but after 4 sessions, it is quite good clearance of this tattoo. Another one, multicolor tattoo. It took almost 15 sessions, 2 months apart. We cleared the blue-black color with the 1064 and the red one with the 532. So this is the patient after 2 years. So the right picture was taken 2 years after the end of the treatment, which shows that you still have a lot of improvement after you're finishing the treatment. So you have to give enough time to clear, the pigment has to get enough time to be removed from this, to be washed from this area. The same patient, we did 15 treatments for this tattoo. And on the right side is also after 2 years after we finished the treatment. This is some kind of special one tattoo because of the two important features. It's a very dense ink, black ink, and also it is a circular tattoo which covers 360 in the forearm. It is very difficult to do. My formation as a plastic surgeon suggests that you shouldn't treat these kind of tattoos, which are circular, as a 360 approach. So we should split in halves and treat it at a few weeks apart. So this is what we did. And actually, we did 26 sessions, which means we treated this tattoo for 13 times each half. And for the last 10 treatments, we combine this 1064 5 millimeter spot, 5 to 3 millimeter spot, 1 joule, 5.5 joules per square meter with the core, just to remove the pigment because of the oozing and to decrease the blister formation. Because in this dark ink tattoo, the blister formation is the rule. So this is the result, both halves, the anterior half and the posterior half immediately after the 13 sessions. Pigmented lesions, we have this Lintigo. We treated with the zoom handpiece, 532 nanometers, 4 millimeters, spot 0.7 joules per centimeter square. And this is the intermediate result in the day 1 and day 7. We have here some crust, which will be nicely healed. This is before and after with the zoom. Another case, same treatment, before and after. So this is a post-inflammatory hyperpigmentation due to a burn, hot iron burn. Actually, this was our first PicoWay case 5 years ago. And this is before, after 1 session, 1064, 6 millimeter spot, 1.5 joule per square meter. Here it was the lesion. This patient came with this kind of hyperpigmentation post IPL hair removal. So our treatment plan was to reduce the pigment using the PicoWay. So we did 3 sessions of Zoom, 1064, and resolve, and 2 sessions of zone 532, resolve 1064, 2.1 joules per square meter. This is the end result. Pigmented lesions post vascular lasers. Maybe this is let's say hemosiderin deposits in the low leg due to splashing of the small veins. We did 7 sessions of PicoWay zone, 4 and 6 millimeters, 1.6, 2.3 joules per square meter, and in the same session, resolve 1064, 2.1, 2.3 joules per square meter, square centimeters, sorry. So the other leg, after the treated with the same parameters. This is a post-inflammatory hip pigmentation. This patient has a childhood burn scar. The treatment plan was to reduce the pigment using the CO2 laser. We did it, but we get no result. And then we moved to it was before we had the PicoWay, and then we moved to the PicoWay, and we did 1 session, 1064 zone, 6 millimeters spot, 1.4 joules per square meters. This is the intermediate result at 2 days, a little bit red, and this is before and after 1 month. This is a very interesting case, an exogenous ochronosis. This is a post-medication hyperpigmentation. She took the calcium chain blockers. I saw a very interesting paper published by my teacher and my friend, Professor Firas. He treated successfully such a case with these parameters. We did it also, and this is before and after 2 sessions. Unfortunately, this patient was lost in follow-up. Maybe she was not so confident with the result she gets, but I'm sure that it will improve a lot if she will continue. We are using also PicoWay Resolve to polish, let's say, the texture and to polish the burn scars, to get better texture and to uniformize the uneven pigmentation. So we are doing like this. We are doing 2 vestiges in the way it shows in this video. Okay. Another case, skin rejuvenation via treatment of benign pigmented lesions, wrinkles, and acne scars. Can you hear me? I can hear. Okay. So we did Zoom 532 millimeter, 4 millimeter spot treatment on lesions, 1 pass, and then Resolve 532 nanometers, 0.3 millijoules full face, and Zoom 8 millimeter spot field treatment. This is a regime proper for skin types, lighter skin types 1, 2, because it can get you can get intense erythema, and we're doing only just 1 pass. This is the result, nice result obtained by my colleague Larissa Nestor. She's a dermatologist. This is before and after. Acne scars, if you are going back to histology, if you are going back to histology, we can see that there's a room for treating atrophic scars, rolling box scars, and also the post-inflammatory hyperpigmentations. What means this PicoWay Resolve so attractive? It is about the very short downtime. This is the patient in day 1 treated with quite high fluence, 2.7, with 1064 nanometers, and this is how it looks in the day 3. So it is much more appealant than the CO2 fractional or the, let's say, RF microneedling. So we were encouraged by this publication. Treatment of acne scarring with a novel double wavelength second domain laser incorporating a novel holographic beam splitter, which was the first publication on acne scars and PicoWay treatments, which I read. And the results were that 81% of the subjects showed improvement with a high patient satisfaction rate, with mild and transient erythema and edema, with no hyper or hypopigmentation or scarring. And this is another one, a new one, which showed also an improvement after the first treatment. And the only, let's say, side effects, transient erythema, swelling, and some purpuric spots lasting 2 to 3 days. So no patient complains of hyper or hyperpigmentation or scarring. So we did this. We did, my colleague Larissa Nistor did 4 passages of PicoWay Resolve 1064, 2.1, 2.7 joules per centimeter square at 1 month. This is the result before and after, a quite good improvement. This is the same patient on the other side. So we are using this tool, this Antera 3D consultation tool. This is a 3D camera, which is a powerful analysis and consultation tool. It provides a full set of features, including wrinkles, texture, pigmentation, and redness visualizations and measurement. It provides also enhanced volumetric measurements suitable for atrophic and hypertrophic scars, which are our case. And it further includes an additional tool for pore analysis, which is also very important for the PicoWay treatments. So this is the Antera 3D report for that patient. You can see a significant improvement in the volume, the depressions under the 1 millimeter. Also, significant improvement in depressions under 2 millimeters, and also in those under 0.5 millimeters, so the pores. Another case, 4 sessions, PicoWay Resolve, 1064, 2.1, 2.7 joules per square centimeter at 1 month before and after. Another case, 4 session PicoWay Resolve, 1064, 2.1, 2.7 joules per square centimeter at 1 month. Before and after 4 sessions of PicoWay Resolve. Let's talk a little bit about skin rejuvenation. So, as we can see, there's a significant improvement in texture after 4 sessions of PicoWay Zoom, 2 passes, and PicoWay Resolve 1064, 1.9 joules for passes. This is the patient before and after on one side and on the other side. Another patient with skin rejuvenation after 2 sessions of PicoWay Zoom 532, 4 millimeter spot, 0.5 joules per centimeter square on lentiginous, and Resolve handpiece 1064, 1.9 joules per square meter, full 4 pass on the full face, and also Resolve 532, 0.4 joules per square meter, 2 passes in the same session. And the same regime on the other side. I think that is the best result that you can achieve for this patient. So thank you very much. And I want to say that I'm very proud of my team, and I congratulate them. They are really professional. Thank you very much.
Thank you so much. These are really beautiful results as well. And as you all can see in the audience, what tremendous things that Pico can accomplish, especially in the right hands. We have time for just one question. I know we've been answering some questions along the way, but want to ask a little bit about tattoos and safety for both of you. What do you think about multiple passes? What do you think about treatment endpoint? What is it that you would recommend? Do you mind commenting first, Dr. Martin? Oh, I think you're just on mute. There we go. I can hear you now.
Okay. I don't see any point to do multiple passes on a tattoo, because while you get the frosting effect, you should not get the pinpoint bleeding. So that's when if you're getting it, you should decrease the fluence, so you get, let's say, a gray whitish appearance for the tattoo. And I do not agree with the multiple passes. I don't see any reason to do it.
And what about you, Brani?
Here, sometimes, in some cases, I have a bit of a different experience. Yes, when you get the frosting, you cannot do multiple passes. But if you cool the skin and wait for an hour, you can achieve another pass, or as Dr. Andrei combined the CO2 especially for the scarring and these tattoos that are not reacting fast enough. So sometimes I combine, especially in patients that they show results that are not too expected. The tattoo is not fading fast enough. I have a lot of patients that are flight attendants and police officers, and they cannot have any tattoos on their body. So sometimes I really combine, but if you combine with PicoWay, from the aspect of safety, I don't really fear of any complications, but you need to have time for that patient in terms, they need to cool off the skin, and frosting needs to pass completely in order for you to have a second pass with the PicoWay.
Yeah. And of course, the R20 method was described in a paper about 5 years ago, 5 or 6 years ago, and talked about waiting 20 minutes between. But there was a bit of diminishing return after about 3 passes. So thank you for commenting on that. Well, I'm going to wrap up our program for this evening, and just again want to thank you both for presenting your tremendous experience and so many great cases with lots of information. I took a lot of notes as well, and look forward to improving my own practice. So thank you both for your time and for your expertise.